Dr. William Schaffner is an infectious diseases expert at Vanderbilt University in Nashville, Tennessee. Doctor, thanks for joining us. How big is the risk of a global Mpox outbreak?
Well, Sally, we have to understand that this new variant, this type 1 variant that's now spreading in the Democratic Republic of Congo and the surrounding countries, is indeed more contagious than the other Mpox variants that we've dealt with in the past. And although there have been very few at the moment exportations, if you will, to other countries not in the continent of Africa, the potential still is there, particularly from travelers going from other countries in Europe, the United States, Australia, anywhere else, to these countries in Africa. If they have intimacies with people, sexual intimacies and other intimacies with people in the Democratic Republic of Congo and other countries, they could pick up this virus and bring it back to their home countries. So that possibility is clearly there, and the public health agencies around the world are on the alert, trying to determine the earliest possible time for these importations.
So Bavarian Nordic is one of a few companies producing an Mpox vaccine. Should we be scaling up to mass produce?
Well, they're doing this maximally at the present time. Indeed, Bavarian Nordic is trying to expand its facilities for the production of more vaccines. The World Health Organization and the United States have donated or are donating doses of vaccine to the Democratic Republic of Congo, trying to do source control. If we could do more vaccination there, there would be less risk of exportations to the rest of the world.
We're also hearing, however, that some countries not affected by Mpox are stockpiling Mpox vaccines, and the DRC does not currently have enough.
Well, the DRC currently does not have enough. That's understandable. And it's also understandable that other countries are having a stockpile of Mpox vaccine in order to prevent transmission in their countries should there be importations. Both things are reasonable. I wish we had much more vaccine available.
Of course, we all look to what happened during COVID. Have we taken on board the lessons, particularly around vaccine availability, that we should have learned during the COVID pandemic?
Well, we can also always take more lessons from what we've learned. Here we have one major manufacturer of this vaccine for a disease that's now become very important globally. I wish we had more vaccine manufacturing resources.
What else should we be doing to make sure Mpox does not grow into a massive pandemic?
Well, all over the world, if you're going to travel to these countries that are currently affected, please get vaccinated. That will protect yourself and make it much less likely that you will import this vaccine back into your own country when you return. So that's very important. And then two, we should all be helping the Republic of Congo and the surrounding countries in dealing as best as possible with their own circumstances, giving them resources, financial resources, and as much vaccine as we can supply.
Thank you very much for your time, Dr. William Schaffner, an infectious diseases expert at Vanderbilt University in Nashville, Tennessee.